Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.
I'm Dr. Melanie Rosenblatt, and you're watching Live Pain Free.
Welcome back to Live Pain Free. We're talking today with spine surgeon Dr. Rob Simon, and we've been talking about a whole host of things, and we're going to focus in on something now that I'm personally very interested in, and that's more of the sports medicine mentality and some of the things that are happening. Now, we know, for example, that there are a lot of big high-end athletes who have, Kobe Bryant, for example, Peyton Manning, have had to go out of the country to get stem cell therapy. Everybody goes, ooh, stem cell therapy, what's that really all about? And it's really not what people think. It's not what the political folks have turned it into. And now, for the first time in the last year or so, you've been able to get stem cell therapy right here in South Florida. So Doc, if you could, just share with everybody what's happening with stem cell therapy and what it's used for.
It turns out that stem cell therapy is not as foreign as you think. We've been using stem cells for a long time. Stem cells are brought out when we do a knee scope and we have a fracture of the cartilage with the bone exposed. We'll put a probe into that, crack the cartilage and the bone, and we'll bring in stem cells from inside the bone. So we've been doing this type of thing for a very long time. We do things to stimulate stem cells that are in the natural bloodstream and in the tissues.
And let's tell everybody, let's make sure, because we don't know what people know. Stem cells are undesignated cells that will turn into wherever they go in the body, theoretically, correct?
Theoretically, the idea is they will respond to their environment and the cues given to them by the surrounding tissues in forming new tissue. So they're called pluripotent. They can become whatever cell line is demanded of them and whatever they're inspired by.
It's really wonderful stuff.
It really is.
It's amazing. Right, yeah. Right. It is. So go ahead. I didn't mean to interrupt, but I want to make sure everybody understands what we're talking about here.
So the idea is if you can bring stem cells in sufficient concentrations into areas where there's an injury or a need for repair, you can put them into that spot and you can get them to form the cells that are needed in that area. So we're using a lot of it we're doing it in the spine, we're doing it in fracture healing. So stem cells are very important. And so our arthritic patients and other patients with damage to their tissues, we want more new tissue. So stem cells are providing a very promising avenue for doing that. The issue is getting enough stem cells in sufficient concentration.
Right. Now, you're a surgeon, but stem cell therapy is not a surgical procedure.
It is not
minimally invasive percutaneous, which basically means just an injection.
For different types, it depends on what you're talking about. When we do big fractures, we go in and we take out bone marrow and we put that stuff in there to get the stem cells to the location. Right. But we can do it now with minimally invasive techniques, with needles, and have a good result and get a fair bit of stem cells out of it.
Right. Well, I was involved with a group that was doing stem cells for quite some time, and I have a story I want to share. I was asked, can you take this guy home after his procedure? And I said, sure. What do I know? I took the man home. I never met him before. He had just had his procedure. He gets in my car with his crutches. He came in with his crutches, couldn't hardly walk, and I drove him. I would say it was probably 5-6 miles. It was enough time for us to chat a little bit. I pulled him into his driveway, and I said, let me help you out of your car. And I was just being a good Samaritan and helping out. Here are your crutches. He says, I don't need my crutches. Look at this. And while we know that doesn't happen to everybody, the potential for that to happen was enough to get me excited that, look, even if it doesn't happen, you give it a shot, you don't have really much to lose, and you've got an opportunity to really have a game changer and a life changer, right?
You can, and these cells are your own cells. It's not like there's a foreign body, so there's really no reaction.
Right.
So it can make a big difference, and if we can get these things to do what we want them to do, it can really change everything we're doing.
Now, outside of pain management, I read an article the last couple of days about designer parts for body. I think in England in particular right now, they just completed a study and they said, oh, we'll be able to grow your new nose or grow whatever. But it's all stem cell therapy that they're really talking about, isn't it? They're using that type of thing to ultimately grow parts for people that are going to need replacement parts.
They're using pluripotent cells like stem cells, and now the recent one is 3D printing of heart muscle and heart tissue.
Unbelievable,
and,
huh?
Well, they've been doing it with bladder. They've been using scaffoldings. They'll create a bladder out of a protein and a scaffold of natural tissue, and then put cells onto that and encourage them to grow to form an organ. Artificial esophagus, bladder, those type of things.
It's really exciting. I mean, let's face it, we know we live in a world where the change is so rapid, but we're really on the cusp of the Star Trek mentality. I mean, where basically you're able to diagnose and say, oh, why not do this and fix them. So we're really excited that you and others are bringing that to South Florida and to the U.S. I think there's a whole host of people that will benefit. Obviously, somebody who's got a long, healthy future ahead of them, it's certainly worth them looking into stem cell therapy. And hopefully Dr. Simon will be there to answer your questions. Thanks for joining us today on Live Pain Free. And Dr. Simon, thank you again for being on the show.
My pleasure.
Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain free. Call today.